Good evening, and I'm sorry that we are slightly late in starting this briefing, but I'm pleased to be joined this evening by our Director of Public Health, Dr. Henrietta Hewitt, and the Chief Executive of Manx Care, Teresa Cope. As we enter February, spring is dawning on the horizon, and whilst we can look back on a challenging winter period from our island's public health perspective, we can, I believe, look forward to the future with a sense of optimism. Despite the challenges we faced in December and January, with the identification and then the rapid spread of the new Omicron variant, people across our island once again, quite literally, rolled up their sleeves and did their bit to protect themselves, their loved ones and the wider community. We saw record numbers of vaccinations delivered in December, ensuring as many people as possible were protected from Omicron when it made its ways to our shores. And that Herculean effort to get jabs in arms paid off. We owe a debt of gratitude, I believe, to the vaccination team who made this possible. Thank you. 90% of the island's adult population have had 2 vaccine doses, and 65% of the adult population have had a booster. The Omicron wave was the biggest we have seen since the start of the pandemic. At one point, we had almost 3,000 active cases on the island. But whilst Omicron spread more rapidly, it was generally milder and our immune systems were better prepared, thanks to many having had that vaccine protection. That is not to dismiss the impact of COVID. Whilst Omicron is generally mild for many, since the start of the pandemic, many people have been ill, and sadly some in the community have lost their lives. An element of risk, of course, continues, as we have been reminded this week with 2 further COVID-related deaths reported. Our sympathies are extended to the families. Nevertheless, with the Omicron wave, the number of deaths and severe illnesses have been significantly lower than those worrying days in early 2020 as COVID-19 took hold. I also recognise the impact of Omicron has had on businesses coming during the festive season on which so many hospitality providers depended. And I recognise the impact of the rapid spread has had on staffing, with so many people having to isolate at the same time. I know there were pressures in keeping essential services running, from making sure our hospitals and care homes could continue to ensuring supermarket shelves were stocked. Despite, though, having had our biggest COVID wave to date, the island weathered this storm without a lockdown. Schools remained open, our health and care services continued to function, we moved to self-testing and reporting, and we were able to reduce self-isolation times by allowing exit after 2 negative self-tests 24 hours apart, which cut isolation in half for many. The decisions that we made before Christmas in terms of moving to self-testing with lateral flow devices and reducing isolation and contact tracing requirements have led the way in terms of country responses to Omicron, and these measures were subsequently adopted by neighbouring jurisdictions. I want to thank all of you for the manner in which you adapted to these changes and the responsible manner in which cases were reported and self-isolation undertaken. The community can once again take tremendous pride in what has been achieved. Much has been learnt since December and the onset of Omicron. There is a sense that the rapid spread of the virus and its relatively limited impact on health and care services and the low rates of severe illness and death represent the first real step in COVID-19 becoming a disease that is endemic. We must now build on this and set out a clear vision as to how the island will step away from the rules and regulations that have been necessary to control the virus over the past 2 years. We will move to once again being free to make our own decisions, informed by clear guidance, particularly for the most vulnerable in society. Move to once again being trusted to do the right thing at the right time and in the right way. And before I go into more detail, I'd like to hand over to our Director of Public Health, Dr. Henrietta Hewitt, who will cover what we mean when we talk about a disease being endemic and where we are currently with COVID-19. Dr. Hewitt.
Thank you, Chief Minister. A disease is defined as endemic, and this is an infectious disease we're talking about now, when it's persistently present in a community at low to moderate levels. So this is not a situation where you're looking to eliminate the disease. You're accepting that it's going to be there, and within that it may change over time. Some infectious diseases are seasonal, like flu and some of the other cold viruses. Others may not be, and we're not quite sure how COVID will play out in that. But we will expect to see variations from baseline, and that would still be consistent with the endemic position. In terms of where we are with the current wave, obviously we've been analysing this week by week in our epidemiology report, which I expect many of you will have seen. And as Chief Minister indicated, we've come down from the very high levels to a level which is currently today, I think we've got 471 active cases and we had 65 new cases. So we are plateauing, and you can see that from the graphs and the trend line in the weekly report. And that's what we would expect. We wouldn't expect the fall to continue on the same trajectory. We expect it to plateau. We've seen that in South Africa. We're beginning to see it, or more than beginning to see it, in the UK. And that will continue to be the case while we have cases in the community and people who are susceptible. And that will depend on people's levels of immunity and their behaviours, the degree of mixing. So again, it may change, for example, festive periods, other holiday periods, cold weather versus warm weather, etc. So we won't expect to see one single level of this. It will continue to fluctuate, but it should be maintained at levels which we can live with as a community. Thank you, Chief Minister.
Thank you, Dr. Hewitt. In moving to an endemic approach, we must acknowledge that there will still continue to be challenges, and there will still be times when we are faced with a degree of uncertainty and renewed threats. We must be prepared to deal with those effectively, efficiently, and proportionately. In considering a move to an endemic approach, the right conditions for change must be present. The Council of Ministers consider there to be 5 key conditions. Firstly, our health services are operating normally. Secondly, vaccines remain available and effective. Thirdly, there are no new variants of concern that may lead to serious consequences for public health. Fourthly, the situation on the island is stable. And fifthly, the situation in the British Isles is stable. Subject to these 5 conditions being met, it is the intention of the Council of Ministers to return the island to normal life on Thursday, the 31st of March. This gives us time to ensure that as many people as possible are fully vaccinated. In particular, those who are clinically vulnerable now being offered a 4th vaccine dose, and 5 to 11-year-olds with certain health conditions who are now being offered the vaccine. This change in approach means accepting that the virus is present in our community for the long term. Whilst we will continue to monitor its spread to ensure we understand how it is affecting the island, we would not look to identify each and every case. We would treat COVID-19 in the same way as other communicable diseases such as novovirus or flu. The core public health regulations will be suspended. Our core approach will shift to solely guidance and advice and not the force of law. Our daily reporting dashboard will be reduced and then removed. Our decisions and daily lives will no longer be linked to the number of cases on the island, although the impact on our health services will continue to be monitored. At our borders, there will be no travel restrictions and no public health checks on arrival. This is regardless of residency or vaccination status. People will be able to come and go freely from the 31st of March. The only requirement will be for travellers to complete a simple travel declaration form ahead of arrival on the island. This will be an interim measure as we transition to the new arrangements in case people need to be contacted in the event of a new threat emerging. This will be in place for the shortest time possible. The only potential restriction that will remain will be the UK's list of red countries. Currently, no countries feature in this list, but any UK restrictions would extend to the Isle of Man if a country were to be added. Generally, this would be due to a new variant of concern, as we saw with South African countries in December with the emergence of Omicron. Some changes to border restrictions in England recently announced by the UK government will come into force there on the 11th of February. This relates to non-vaccinated international arrivals, those aged under 18, and other matters. We are currently reviewing these changes, and next week I hope to be in a position to announce any changes to our own border arrangements that will be in place ahead of full removal of restrictions on the 31st of March. As far as positive cases are concerned, on testing and where someone tests positive for COVID-19, they will still be encouraged to record their positive test for surveillance purposes, and the advice will be to stay at home and rest, as you would with other viral infections. If you are COVID positive, face coverings will be advised if you have to leave the house, but there will be no legal self-isolation requirements. This is about trusting people to be responsible and to do the right thing, as we tend to do with other communicable diseases such as flu. Contact tracing will cease, although people will be encouraged to notify their own close contacts and indeed their employer that they have tested positive. As has been the case throughout the pandemic, advice and guidance will be available to help people make informed decisions. Hands, face, space and fresh air will remain with us, as will the ability to self-test. I accept that these changes represent a significant shift after almost 24 months of COVID restrictions. I have no doubt that the vast majority in the community will welcome this move, but we must be mindful that there will be some who wish to be more cautious, particularly those who are more vulnerable to disease. We must all continue to be tolerant and understanding. There are those who will continue to wear face coverings and keep their distance after the 31st of March, and we must respect this. We will ensure that appropriate guidance and bespoke advice is available for those most vulnerable in society, identifying those most at risk due to underlying health conditions, so that no one feels excluded or marginalised as a result of this new approach. Should any of the 5 conditions that I have listed change, we must be in a position to act quickly and proportionately if the situation warrants it. This could be due to a new variant of concern being identified that poses such a significant threat to public health that our health services once again come under significant and sustained pressure requiring government to act. Over the coming weeks, we will be preparing communications to fully explain these changes to everyone in our community. Today, we are publishing the revised approach I have set out, which will shortly be available online at gov.im/COVID-19. The Council of Ministers will continue to monitor the situation and indeed will make an absolute final decision in March on whether the 5 conditions have been met and indeed whether they have changed. Throughout the pandemic, protecting our vital health and social care services has been paramount. As important as overall case numbers have been, it is the pressure on hospital beds and staffing numbers which have been a key barometer by which we have judged the severity of outbreaks and used to guide our response. Our vaccination programme has been of vital importance, and as I set out earlier, ensuring vaccines remain viable and effective is one of the key 5 conditions for change. COVID vaccination will remain a part of our lives. Now I'd like to invite Teresa Cope, Chief Executive of Manx Care, to talk a little about the current situation at Nobles Hospital and the wider health and care service, and to provide an update on the vaccination programme. Teresa.
Thank you, Chief Minister. So Manx Care continues to monitor on a daily basis both the patients that are in hospital with COVID-19 and also the number of staff absences which are due to our staff having COVID. And these are 2 key barometers that we use to maintain the sustainability of healthcare on the island. As of today, we currently have 6 patients in hospital with COVID-19, and our staff absence as a result of COVID-19 is around 2% of our staff. Over the last 3 weeks, we have seen the numbers of patients with COVID-19 in hospital stabilise and gradually reduce. and the overall stay in hospital for those patients is less. These patients are generally less sick. So we are in support of the plan. And what I want to also outline today is our approach in terms of the wearing of masks. Manx Care has carefully considered the wearing of masks in the context of the island plan and moving down to level 1. And whilst level 1 deems that wearing of face masks is recommended and not mandated, we are of the view that we need to take a cautious approach to maintaining mask wearing in a health and social care setting in order to protect the most vulnerable individuals within our care. We will continue to closely review this position with the ultimate aim and objective of being able to only use masks where we absolutely need to for clinical reasons or for those people who exercise personal choice. Fresh masks will be provided for all individuals entering health and care settings. And whilst we are taking a cautious approach to reducing mask wearing, we are able to downgrade and allow additional visiting. So Manx Care will no longer require hospital visitors to pre-book their appointments or complete registration forms. This is to minimise the impact, but we do advise that people exercise caution around the numbers of visitors and also take steps to ensure they undertake lateral flow testing before they come to the hospital. This is signalling a new normal for health and care. The hospital continues to experience its usual seasonal pressures, but it's important to stress this is not due to the number of COVID-19 patients in hospital at this time. So I'd like to hand back over to the Chief Minister.
That's great. Thank you very much indeed, Teresa. So I think now we'll go straight to questions from the media. And first up, I have Meg Walker from 3FM.
Good evening, Chief Minister. You mentioned earlier about the COVID-19 daily dashboard being reduced and then eventually got rid of. Will there still be any way for people to access the figures, as some people might feel a bit anxious or vulnerable and want to know what the current COVID situation on the island is?
Well, we still have a weekly report from Public Health, which will be able to give some indication. I think that when you move to a situation when there is no compulsory reporting, when you are doing it for surveillance, the figures become perhaps slightly less meaningful than where they were in a situation where everything is being reported. But could I actually just hand over to Dr. Hewitt, who produces that report, perhaps just to add a little bit more weight to the decision to move to that position?
Thank you, Chief Minister. So yes, as Chief Minister has said, we will continue to publish the weekly report with all the data and the tables and the graphs and so on that it currently has. As I said, we look to be reaching an endemic position with a plateauing level, but as I also said, that plateau will not stay absolutely level. It's likely to go up and down. And therefore, I think one of the things, we know just how big an impact COVID has had on people's mental health and well-being. And I think part of that has been, the fact that all of us have got a bit hooked up on numbers, maybe in the past, probably myself included. And I think we need to get away from sort of thinking, it's 3 o'clock, I need to check, because yes, the numbers will change a little from day to day, week to week. The R number may go up a bit, down a bit, but that doesn't actually mean anything in terms of, the risks to us. If we do see a sudden surge that looks like hyper-endemic, to use the phrase, or indeed an epidemic where it's gone up way beyond the levels we would expect, then obviously we will pick that up from the testing results as they come through, and we would take action about it. But I think that doesn't need people to feel that they've got to still check a number every day, and it's probably going to be better for our well-being if we gradually stop that. Thank you.
Great, thanks, Henrietta. I think what I'm going to do is give every journalist present a first bite at the cherry, and then we'll come back for second questions after. So I'll move straight on to Alex Wotton from BBC Isle of Man.
Just on the Manx Care sort of policy here, from a clinical perspective, there does seem to be, or what remains to be, a separation between Manx Care's policy and government's policy. So for some people that may find that a bit odd, could you explain from a healthcare perspective why that is the case?
Teresa, I think question for you.
Yeah, I think it's a relevant question. It's one we've really carefully considered. We recognise in the short term there is a slight disconnect between the approach we are taking in the health and care setting as opposed to the island setting. However, what I would say is we care for some very vulnerable individuals, and it's about taking a proportionate and cautious approach initially just to in those early stages. But we absolutely do want to make sure we are only using face masks where it's clinically appropriate in time. But having carefully considered it and taken on board all of the advice from the professionals, we feel it's right to ensure that we keep that cautious approach just initially in those early stages and then downgrade as we move forward.
Thank you.
Okay, thanks very much, Alex. So we'll go next to Jeff, Sam Turton.
Thanks to my Chief Minister. I just wondered if we could say with the travel declarations, if people aren't submitting landing forms anymore, and for example, for travel on the boat, you aren't required to produce photo ID, how is this going to be monitored in a way that can ensure people are still doing it?
Well, throughout the course of this pandemic, Sam, we've had to put a lot of trust in individuals, particularly over the last few months. It's clear to us that people are responsible in their approach. We have stated this is an interim measure that we are retaining for the time being, and the purpose behind it is to give us a relative knowledge of where people have come from in case there is another outbreak in expectedly a foreign country from which we need to potentially react, and will give us an ability to make a judgment potentially of how many people have arrived on the island from that location. But as I said, Council of Ministers have been very careful to state that this is an interim measure, and we will continue to monitor that situation accordingly. It is our intention. It will be a very, very quick pro forma to complete, and we will give more details as to what that'll look like in the coming weeks before the 31st of March.
Thank you.
Okay, thanks very much, Sam. And Josh Stokes at ITV Granada.
Good evening, Chief Minister. You talk about the right conditions to make changes, and one of those things is the situation in the British Isles being stable. Can you just elaborate on that a little bit? In your eyes, what more needs to happen in the British Isles in particular between now and March to make these changes?
Well, I think we have determined today that these changes will go ahead, subject to the situation changing. I outlined the 5 conditions whereby we would look to alter that decision. And in terms of the UK's position, as you note, we said that needs to be stable. Instability for us would be caused by a change in terms of the impact of COVID on public health, either a significant escalations in hospitalizations or indeed deaths, and or primarily a new and emerging variant of concern that was having a significant change of impact on public health. And that would be primarily the foundation for us to want to now fundamentally change what I have announced this evening.
So at this point, the British Isles is in a stable position in your mind?
Yes, absolutely. They are in a stable position. They are coping with the variant. There is nothing to indicate that we should be anything less now than confident about our position, the foundations that have been provided with the vaccine, and the fact that we do not have any evidence that Omicron is likely to pose any greater threat to us moving forward at the current time.
Thank you.
Thank you very much indeed, Josh. And then Rob Pritchard at Manx Radio.
That's my Chief Minister. My first question is for the Director of Public Health, please.
Well, that's fine. I'd like to hand over then to Henrietta.
Thank you, Chief Minister.
Good evening, Dr. Hewitt. Just with regards to this change to an endemic approach, how much were other clinical professionals on the island consulted on this, and are they completely on board with this decision?
They were fully consulted through the Clinical and Public Health Group that is convened by the Department of Health and Social Care, and which includes the Medical Director of Manx Care, who obviously is responsible for discussing and feeding back from his colleagues, and it contains members of DHSC and Cabinet Office as well. So all of that has been through the appropriate discussion process.
So that was unanimous backing. Were there any disagreements?
Not to my knowledge. In fact, Mrs. Cope is confirming that there were no disagreements from clinicians.
That's great. Thank you very much, Rob. Right, I'm going to run through the pack again. Meg Walker from 3FM, would you like a further question?
Thank you. What's going to happen in terms of government financial support for those missing work due to COVID after the 31st of March?
Right, well, the Treasury Minister has made no announcements regarding that. We are, for the time being, our schemes remain in place, and any changes, if we make any changes, will be announced prior to the 31st of March. But at the present, those schemes remain in place. Thank you, Meg. Alex Wharton at BBC.
Hello again. You talked about how you would like to, or you have to be ready to make changes again should another variant pop up like Omicron did rather suddenly. What is the contingency you have in place, and how much of a deviation from those 5 factors would we have to see? 1 factor, 2, that kind of thing.
Well, there's multiple factors that the Council of Ministers would have to take into consideration, and I'm not going to be backed into a corner on any particular change that would, or change in terms of material impact that would necessarily result in us fundamentally altering our approach. I think the fact is, Alex, I think first of all, COVID has not gone away. I mean, that's the first thing to recognise. We are moving to an endemic position in terms of our approach to COVID, the same position, in other words, broadly as we would do with other communicable diseases, flu, or novovirus, etc. But if the health situation changed, if COVID-19 changed again in terms of its significant impact on public health, we have the experience and expertise now to know how quickly to move into a situation whereby we can bring some control and protect public health. But we should all, as I said before, be confident that the decision we are making has got solid foundations. As I said, 90% of the adult population now have their vaccines. There's a programme still underway, particularly amongst the children and particularly amongst the immunosuppressed. And we're trying to make sure by announcing the date of the 31st of March that everybody who's in those categories gets that opportunity now to get their vaccine. And so the island can adopt the 31st of March with confidence that everybody who wants the vaccine, who needs the vaccine, has been given the appropriate chance to be as protected as fully as possible when we open our borders on the 31st of March.
Okay,
Thank you. Thank you very much indeed. Sam from Jeff, do you wish another question?
Yes, Mr. Cannon, just in terms of this, how do you feel about this yourself? Because obviously your predecessor had to stand there and make a lot of statements that people never would have wanted to make. But do you see this now as a lifting of 2 years of doom and gloom, an opportunity for the island to recover in a very positive manner?
Well, I think the foundations are in place. I've acknowledged during my opening remarks some of the pain and suffering that has taken place. We still have an independent review of what's happened, Sam, to come, and there will still be plenty of discussion. But yes, I think we are in a positive place. There is a lot to do. We recognise that. I think we discussed a lot of that in our island plan, particularly around our economy. A lot of our businesses have had a tough time. But we are approaching the future with confidence. The 31st of March date is a good date, I think, in terms of signalling the sort of spring coming upon us, and also a date that the island can look forward to as a sort of, I hope, the commencement of a new tourist season for the first time in 2 years, I hope to see many, many visitors to our shore. So yes, I think we've got a lot. Platform unemployment is at its lowest now for 20 years and plus. As you know, yes, apart from the domestic challenges, many other of our businesses are actually having have had a very positive time in the last 2 years. Some of the international facing businesses and the digital and financial services sector. So there's a lot to be positive about, but there's a lot for us to do. So we should be confident moving forward. Thanks, Sam. Josh Stokes, ITV. Josh, do you want another go?
Yes, please, Chief Minister. This one's probably more to Manx Care. With these changes now coming into place, there's obviously going to be a shift in, also will there be a shift in helping people who are suffering with long COVID? What's your message to people who are currently suffering, and will Manx Care be doing more in the coming months to prioritise people who are still feeling the effects of the virus?
Yes, we will. So we have currently had a business case through Treasury, working with the Department of Health and Social Care to provide a LongCovered service. So it's currently under development. We are currently scoping what that service looks like, and we will be undertaking a listening exercise for sufferers of long COVID, which is taking place next Wednesday at 4 till 6 p.m. at the Palace Hotel. And that's to make sure, as we plan to deliver this service, we have taken on board all of the feedback from those who have been suffering and make sure the offer is tailored accordingly.
Thank you.
And I think just again to emphasise there, Josh, I mean, 31st of March seems a long time away, but one of the solid reasons why the council has gone for that date is to ensure that those in our community, potentially in a children's cohort, who are potentially more at risk from COVID than the general population, do get the proper opportunity to be fully protected, or as protected as possible as we move forward. So I want to reassure everybody that we're making decisions in the interests of the whole community, and I hope picking the dates considering the greater interests of the whole community. So, Josh, and finally, Rob Pritchard, would you like another question?
Yes, thank you, Chief Minister. Again, this one is probably for Manx Care. Just a bit of clarity, and apologies if this was mentioned just before, but you've already talked about visitation and mask wearing in care settings. I just want to know what Manx Care's policy would be on positive cases. If someone has COVID, they may be symptomatic or not, but if someone does have COVID, can they still make their way into a hospital setting? And the same with care homes, for example. If there are COVID cases in care homes, could we see suspension of visits, for example?
We wouldn't want to suspend visiting. But we would still encourage people to take LFTs before visiting vulnerable settings. And if someone does test positive, we would encourage them not to visit those settings.
Just as a supplementary to that, if the tracking of these cases is changing, and obviously there are many residents out there who are incredibly responsible with this sort of thing, but if the tracking isn't maybe as specific as it has been in the past, we've all heard from yourselves and government just how important it is to check the pressure on health settings. How can you track it effectively if the tracking system is voluntary? How can you check just how bad it may get? We hope it doesn't get there, but just how much pressure the health service could be under.
So what we do know is that the population have worked very compliantly with us. So there is high degrees of compliance with both testing and compliance with the guidance Manx Care have put in place around visiting. You're right, there is always a risk as we move to this new plan. And that's partly the reason why we took that extra precaution of just leaving it a little bit longer before we step down the wearing of masks. In terms of how we take the barometer and the test around staff absence and the number of COVID positive patients, we do keep in place our command structure. So we monitor this on a daily basis, several times a day, both the staff absence and the number of patients in hospital. We will keep our command structure in place, albeit slightly relaxed. We still have silver command meetings and an ability to feed up through to the DHSC and also to the government if we're coming under pressure. And you will have seen us describe our operational pressures in terms of levels. So we will report on any daily basis whether we are level 1, which is business as usual, right through to level 4, which is under severe pressure. So we use that as our guide. That isn't always about COVID, that's just about the general level of pressure that we're seeing in our health and care system. But we use that as a barometer both to inform DHSC and wider government about the pressures health and care settings are feeling. And that will be a daily process and will always continue.
Thank you.
Great. Well, can I thank the press very much for their time this evening? Indeed, can I thank you all for your time this evening? It would not be right to look towards the next chapter in our COVID journey without acknowledging the losses and sacrifices made by so many during the pandemic. It is an event that will be with us for the rest of our lives and talked about for generations to come. The cost has been great, and as we look to the future, we would do well not to forget the past, remembering those who have lost to this dreadful disease and the lasting pain and sense of loss many family and friends continue to feel. But despite the challenges and the heartache, the pandemic has also brought out the very best in us. We have seen our sense of community and commitment to each other shine, pulling together, caring for each other and doing the right things for the greater good. We should not assume, of course, that this pandemic has ended, nor that COVID may not yet have a sting in its tail, but the conditions are right to move forward with confidence. Despite the hurt and tragedy, the people of the Isle of Man can hold their heads high and look back, yes, with sorrow, but also with pride on what we have been through in the last 2 years. Thank you and good night.